Hello, my name is Martin Lipscomb, and in this conversation I'm joined by Associate Professor Robyn Bluhm. Robyn works at Michigan State University, USA, where she has a joint appointment in the Department of Philosophy and also Lyman Briggs College. A philosopher by trade, Robyn focuses on questions thrown out by neuroscience and medicine and the relationship between ethics and epistemology in these areas. She has edited several books, including Neurofeminism, New Directions in Philosophy and Cognitive Science, with Heidi Maibaum and Anne Jacobson. She's edited The Rather Good Knowing and Acting in Medicine, and with Sharif A. Taken, she's edited The Bloomsbury Companion to the Philosophy of Psychiatry, and Bloomsbury is a great imprint. So Robyn has an extensive publication record. She's contributed to numerous volumes, including mine, and she's an accomplished scholar. Robyn, thank you for taking time to talk with me today. Now, in contrast to your more developed writings, I'd like here to address a short commentary piece that you wrote for the Journal of Evaluation in Clinical Practice in 2010 called Evidence-Based Medicine and Philosophy of Science. Now, I like this piece because it's short and it spotlights, it makes accessible several themes that appear in your more expansive writing, and hence it provides, I believe, a nice entry point into your thinking about the evidence-based movement. Please, can you outline for us what it was that you argued for in this commentary?
Sure. So, as you know, evidence-based medicine has a hierarchy of evidence, which is actually a hierarchy of methods. It places randomized controlled trials at the top of the hierarchy above epidemiological trials that are similar to randomized controlled trials but don't use random allocation, and also above case studies or case series and studies that look at physiological mechanisms. And philosophers have written a lot about problems with the hierarchy of evidence. One major argument is that randomization does not do everything that is claimed on its behalf. Probably the classic philosophical paper on that is by John Worrell, whose paper I'm responding to in that piece. And then another issue is whether mechanistic research or research on physiological mechanisms is as problematic as it should be. I don't want to say that we shouldn't do randomized controlled trials. I think they're very useful. It's just that the claims in favor of them are overblown, in part because generally randomized controlled trials are designed to get what I've elsewhere called a clean evaluation of the effects of a medication. So the ideal would be to compare outcomes in a treatment group and then roll back time and compare exactly the same outcomes in exactly the same group without the treatment. But since that's not possible, though I'm sure someone's working on time travel, the idea is that the experimental and the control group should be as similar as possible. And added to that, within the groups, they should be as similar as possible to each other. So most trials restrict ages. For example, elderly people are not generally included in clinical trials. People with comorbid conditions, people taking medications other than the study drug. And while this is really helpful in that it allows a more precise assessment of the effects of the drug, it only allows an assessment of the effects of the drug in people who are like the people in the trial. So this raises the problem of external validity. Even if within the study group, the drug is shown to be effective, it's a big leap to say that it's going to be effective in clinical practice more broadly, where you will be treating elderly patients, patients with additional comorbid conditions, patients who are taking multiple other medications. And this is known as the problem of external validity. Do the trial results apply outside of the clinical trial itself?
Okay, that's a very nice synopsis, thank you. Now, within the commentary piece, you make or you raise a very strong criticism of evidence-based medicine, when you note that, and here I quote, despite the insistence of the proponents of evidence-based medicine that, of course, no one believes that RCTs are the only good evidence, or even always the best kind of evidence, it has yet to develop a replacement for a hierarchy that clearly places randomized studies at the top, or to attempt to explain the circumstances under which a non-randomized study might be superior to a randomized one, end of quote. Now, many introductions to evidence-based nursing also valorize randomized controlled trials and the hierarchy of evidence, and hence arguably your criticism possibly applies equally to evidence-based nursing as well as evidence-based medicine. At the same time, and this may be somewhat contradictory, many of these same methodologists also assert that qualitative work has use value, and I appreciate that's a tricky term, when, for example, it delivers insights into patient experience. So is this our get out of jail card? If we nurses say that qualitative research grants insights that experimental studies fail to provide, does this meet your criticism? Is this a means by which non-randomized studies might be superior to randomized ones?
I think the short answer is yes. And I think that the evidence-based medicine folks would actually grant that. If you look at the user's guides to the medical literature, and I'm reasonably sure that the nursing analog follows almost exactly the same format, but with slightly different examples. There is a chapter on assessing the quality of qualitative research, and as with RCTs and non-randomized studies, it talks about the methods that deliver the best results. I don't think anybody would want to say that you need to do a randomized trial to understand patients' experiences. But I do think that the problem is that evidence-based medicine implicitly focuses most on medication trials. So even more complex interventions that can be captured or that can be tested in a randomized trial, things like psychotherapy, don't really fit that clean and tidy internal validity model very well. So I think that one of the good things that EBM has done is drawn attention to study quality, and that's also true in the case of qualitative research. But I think that, as you say, if we're interested in patients' experiences, then a randomized trial is definitely not going to be useful.
Okay. There are many criticisms of the assessment of the quality of qualitative research, which I think perhaps complicates that story.
Right.
I don't know if you'd want to say anything about that, but I was also going to ask you questions about evidentialism. Should we only believe those things for which evidence exists? That seems to be implicit in a great deal of the writing on evidence-based medicine and also evidence-based nursing. What do you think?
I'm going to do the standard philosopher thing and change the question, or maybe the standard undergraduate thing where you see that test question, you can't answer it, so you shift it to something you can answer. I think this actually raises the question of what is evidence or what counts as evidence, and implicit in that is that we're talking about good evidence in particular. I think it is problematic to believe things without good evidence. So of course we do, because we often don't have good evidence and need to act in the world or need to refrain from acting, and we have to sort of work with what we have. Even the evidence-based medicine folks, when they talk about the hierarchy of evidence, say that clinicians should look for evidence as high on the hierarchy as possible. But if that doesn't exist, then you settle for less. Settling for less can be problematic if the evidence doesn't actually support the decision that you're making or the action that you want to take. But sometimes we have to. I won't get into the issue of willfully believing things that are contrary to the evidence, since we're focusing on nursing rather than politics. But I think that, in anything that we believe or anything that we do, we take ourselves to be acting for good reasons, and those reasons are based on some understanding of the world that could be described as evidence.
Okay.
In the context of healthcare, I think it's more complicated because we, certainly don't want to randomly try things to see if they work, though I know that there's been sort of a history of that when people are desperate. So, whereas I can maybe get away in my personal life with believing things on the basis of poor evidence or little or no evidence, ethics would probably suggest that, or at least a fairly strong ethical position would probably suggest that in the absence of evidence, it actually is better to do nothing.
Okay. Let me ask you another question, which I think follows on from, or is implicit perhaps in some of your writing, although not necessarily in this commentary paper. And that's linking truth claims with scientific method. Do you think, or rather, does the application or following of methods lead necessarily to defensible truth claims? Now, I appreciate that truth claims are always tentative, contingent, and fallible in science, but it does seem that that link is often made by those writing about science and evidence.
So I am not a metaphysician. Truth is scary. I think that we can make defensible truth claims about very simple things. But when it comes to science, in a sense, scientists are always making false claims. So if you think about laws of nature, they're not universally true in a literal sense. They're more like generalizations hedged with a lot of ceteris paribus clauses. So if that is your standard for truth, then definitely no, good methods don't lead us to truth. If you want to be a pragmatist about it, which I think philosophers tend to do when they're feeling pushed into a corner, then truth is what works. And if science can tell us what works, then that's all the truth that we need, or all the truth that we can hope for.
Robyn, that was a very American answer.
I am not American.
Thank you very much. I thought that was very interesting. I would heartily recommend your writing on science, and particularly your writings on some of the interesting problems that surround randomized controlled trials, to anyone who wants to explore those further. But thank you very much for your time today. I thought that was very interesting.
Thank you very much.